Warm welcome to today's talk. It's Wednesday, the 16th of March. Now, what I want to do is really point out the need I feel now to move much more towards natural immunity, because we are basically endemic now. Now, we can't say we're fully in the endemic stage of this pandemic yet, because it's not yet fully predictable. Or at least with endemicity, we would expect more predictability, but we're pretty well getting there. And this virus is going to be with us for several years. Perhaps several decades, we don't really know, but in the long term, medium to long term. And that means we're all going to be exposed to this virus. I see no way around that at all. Now, my thinking started on this with this article here that I read, just in the popular press. Scotland, mask mandates. So Nicola Sturgeon, the First Minister of Scotland, just decided it's prudent to have mandatory mask rules until the 4th of April at the earliest. So mandatory mask wearing in public areas in Scotland for at least another 2 or 3 weeks, whereas in England we're not. But let's carry on. Mask rules, case numbers well ahead of England. So even though they've got these mask rules and they've had tighter rules in Scotland now for some time compared to England, really, for some weeks, they're getting many more cases, because it seems to me that in Scotland they're missing the opportunity to acquire natural, in most cases, post-vaccination immunity. But why do they not seem to get this? Now, let's look at the figures to support this. Now, this is the latest from the Office for National Statistics, so we can be sure of these figures. These are as accurate as we get. England, it's 1 in 25 people currently. Well, this is the week before. It's always a week out of date, of course. Prevalence currently infected with the virus, 1 in 25 people currently infected. Wales, slightly lower, 1 in 30. Northern Ireland, 1 in 13, so more people there. But Scotland is 1 in 18. So if we can compare England with very low levels of restriction, where I would assume we are experiencing and generating natural immunity much quicker, compared to Scotland, where the prevalence is much higher. So prima facie evidence from this temporal correlation would suggest that this prudent approach is actually not working particularly well, because we're moving into the endemic period. Now, what I just flashed up there by mistake, but I'm put it on deliberately now. This is from Medscape, and this is an article which is basically arguing for that. So I want to sort of critique this a bit now. COVID-19, why are we ignoring infection-acquired immunity? Because we are. Why is this happening? Now, I think I know part of the answer to this. Part of the answer, I'm not saying it's all the answer, but part of the answer is governments still want to encourage as much vaccination as possible. And I think that if governments feel they introduce nuance into this, then the public are so stupid that they won't understand. Well, I don't think you're stupid, and I want the full facts so I can make decisions. We need to move away from this one-size-fits-all strategy, and that's what I'm going to be giving evidence for. We need to individualise the care that we're giving people. So this article from Medscape, antibodies from natural infection are more abundant and more potent, at least 10 times more potent than immunity generated by vaccine alone, according to this Medscape article. And as I said, we will be critiquing this, so we will be giving further evidence that does support the accuracy of what this article is actually saying. It's actually quite a nice article. I've put the link in, of course. Completely accessible. Do flick on that. You can read through it in 5 minutes. And it really does make a lot of what some governments are doing look a bit, well, let's be kind and say dated, shall we? A little bit dated. 10 times more potent than immunity generated by vaccine alone. Now, we needed the vaccinations to give us the immunity to enjoy as we're exposed to natural infection, because we're much less likely to get sick and much less likely to die and get hospitalised. But now that I've got immunity from vaccination and that is waning, I believe it's in my interests to be exposed to the natural infection now as soon as possible. Now, I can't tell you what to do, but this is what makes sense to me, and this is what is consistent. That's what makes sense for me personally, but this is consistent with this thinking that we're looking at here. Now, we've had this idea of hybrid immunity, which is supposed to be a sort of super immunity. So the hybrid immunity, of course, is if you've had the vaccine and you've had the infection, you're supposed to be super immune. But the data isn't really showing that. The data is showing that if you've had the natural infection, if you have vaccination as well, it doesn't really help that much. It's the natural infection which is the key thing. So the hybrid immunity is good in the short term. So we can get. So I want to get infected with the natural variant while I'm still protected with vaccine, rather than when my vaccine protection is worn off. And that will give me hybrid immunity. But it looks like it's the natural infection that's giving the longer term immunity, irrespective of whether infection came first or the vaccine came first. Now, we did think at first there was data that showed if you were vaccinated and then had the infection, you had good levels of immunity. But it seems to work the other way around. So whether you're infection first, then vaccine, or whether you're vaccine first, then immunity, then the natural infection, it doesn't really seem to make much difference. But if you have the vaccine as well, it doesn't really add that much to the natural immunity, is what this data seems to be showing. There's an increased evidence that immunity derived from natural infection with COVID-19 gives powerful protection. And the thing to underline there is on its own. On its own. So that is basically the thrust of this article. Let's just look at a couple of more things it says. Natural immunity has been shown to be both highly protective and long-lasting. So it looks like we're getting better longevity from natural immunity, from natural infection. And natural infection safeguards against both reinfection and severe disease, as does vaccination in the short term. But we believe the evidence is starting to emerge now that the natural immunity is giving more longevity. So that is the kind of main thrust of that article. So I wanted to check it out. So I went to this one first of all, from Science Immunology. Vaccination before or after SARS coronavirus 2 leads to robust humoral. Now, the humoral immunity is the immunity in the body fluids. That's basically the antibody immunity. But of course, you and I know the cellular immunity as well, which is the B and the T lymphocytes, which generate longer-lived immunity as well as this. But they're harder to study. So a lot of the studies are still looking at antibodies, which, to be fair, antibodies show whether we've had the vaccination, or they show whether we've had the vaccination, or whether we've had the natural infection. So the antibodies are proxy of infection. And if we've got the antibodies, that means we've had the infection or the vaccination, and that means the B and the T cells have been stimulated for the longer-lived immunity. So the antibodies are a useful proxy. That is fair. And they're also useful. I'm not poo-pooing antibodies by any means. This is from Oregon Health and Science University. So I'm not poo-pooing antibodies, but they're by no means the whole story. That's what I've tried to say rather badly just then. Antibody responses from the initial wave of vaccines in early 2021 have waned over 6 months. So we're getting waning of vaccine efficacy, contributing to increasing breakthrough infections, partly why we've got so many breakthrough infections. So again, in this study, what they did was that these authors, that's these people here, these ones here, they say this. We measured neutralizing antibody responses, those with breakthrough infections. So they measured people with hybrid immunity, people with no infection history, but often vaccinated. And so they were able to compare them. So those with breakthrough infection, so they could compare these different groups, which is a fairly standard research technique. And we find that in human immune sera, that's basically the humoral part where the antibodies will be in the blood. After breakthrough infection and vaccination, after natural infection, broadly neutralised variants to a similar degree. So these people here have had infection and vaccination, and because they've had breakthrough infection, that means they've had the vaccination first. But if we compare these people with these who've just had the natural infection without the vaccination, then they actually do much the same, indicating to me the superiority of the immune response generated by natural infection compared to vaccination. Now, again, this is not saying vaccination is not important, because when I'm exposed to the natural variant, I want to have the protection from vaccines while I'm generating the natural immunity. Otherwise, we'd have a situation where we had way back in the dark days of the alpha wave, where a lot of people were getting sick. So the vaccines have been good for a period of time, but is it time now to move on to natural immunity from vaccination? I think for most people, that is going to be true. It's not an anti-vax message, it's a vax at the right time message, and a natural immunity at the right time message. The message which was true 12 months ago is no longer true now. Situation has changed. It's pretty obvious, really, but governments don't seem to realise very often. Broadly neutralising variants to a similar degree. So this, whether you've had breakthrough infection after the vaccine or whether you've just had natural infection, you've basically got roughly the same levels of protection. Now, age negatively correlated with antibody response over vaccination alone. In other words, older people do not respond to the vaccine as well as younger people. Simple statement, that. Older, and of course we know this from many other vaccinations. The older you are, the crummier your immune system is, basically. You don't respond as well. So younger people are producing better humoral antibody response, and therefore presumably T and B cell response as well, compared to older people. That's pretty straightforward. So the vaccinations aren't working as well in the elderly as in the young, but there's no correlation with age found through breakthrough or hybrid immune groups. So the older people are responding to natural infection just as well as younger people, but older people are not responding to vaccine-induced immunity as well as younger people. So the natural immunity is good for old, young, in-betweeny boppers and everyone. And the authors conclude this. Together, our data suggests that the additional antigen exposure from natural infection, so if you have the virus exposure from natural infection, this substantially boosts the quantity, quality and breadth of humoral immunity response, regardless of whether it occurs before or after vaccination. So if you get the natural infection after vaccination, so you are protected, you're going to have a big boost. But the Scottish government seems to be trying to prevent this big boosts of the quality, the quality, the quantity, and the breadth of humoral immunity response, even if it occurs after, or preferably if it occurs after vaccination. Now, this is consistent with the CDC data that they did publish for a while. Now, look, this is back in January. And back in January, they were saying this. By early October 2021, persons who survived a previous infection had lower case rates than people who were vaccinated alone. So there we go. That is what they were saying back in January. Persons who'd survived a previous infection had lower case rates than those who were vaccinated alone. But since then, I actually haven't seen any more data from the CDC published on this, which is disappointing, to put it mildly. We will be checking on some that they have done back then, but it hasn't been updated as far as I can see. Now, if you're in the States and you follow this closely, do let me know if I'm wrong on this. And the final line of evidence I want to look at is from the what's that one? The final line I think we'll look at is from the European Medicines Agency. I was going to look at some data from India as well. I'll just show you that briefly. But the India data is basically consistent. It's strong. Yeah, this I'll show you this actually. I've got a bit out of order here. So this is the India data here. This is this article here that we're looking at. Obviously, you have the link. And this, again, talking about natural immunity, and the Indian scientists are saying strong plausibility the development of antibodies following natural infection not only protects against reinfection of the virus to a great extent, but also safeguards against progression to severe illness and death. So, again, there's a lot of data in the India article, but that's just to summarise it. I haven't done it in great detail because it's not yet peer reviewed, but it is a pretty good article from the Indian doctors and scientists. So again, their conclusion is pretty consistent. And the last one I want to look at is the EU drug regulators. Now, this is the European drug regulators, European Medicines Agency people. Now, this is their article. No, I got this is actually from Reuters because this is based on a press report. So I haven't bothered putting the reference in for this. But what they are saying is, that's the Reuters reference there. You can check out the whole article. EU drug regulators express doubt about the need for a fourth vaccine dose. So with the EU drug regulators, we don't particularly like the sound of a fourth dose. European Medicines Agency, Head of Vaccine Strategy, Marco Cavalieri. While the additional boosters can be part of contingency plans, okay, we'll accept that, repeated vaccination with short intervals would not represent a sustainable long-term strategy. We can't keep on giving boosters. We just can't. Boosters every 4 months poses a risk of overloading people's immune systems. So immunologically, it's not really that feasible. And we did look at this with Professor Clancy from Australia, where we found that repeated vaccination, as well as boosting the immune promoting cells, is also going to boost the immune suppressing cells, the so-called T suppressor cells, which are going to reduce the immune response, giving us a greatly diminishing, it's a law of diminishing returns really for further vaccines. And I'm glad to see that the European Medicines Agency are onto this science, because it is basic science actually, as Professor Clancy explained. Poses the risk of overloading people's immune system, which we most certainly don't want, leading to fatigue of the population. I mean, basically, you're not going to get compliance. People are just sick of this. They're not going to. And if there was an overwhelming case, if they could see people around them getting sick and dying who weren't boosted, then that would be different. But of course, we're simply not seeing that. There is a need for an updated vaccine. That they're saying, I question that. So a vaccine which is specific to the Omicron, for example. But they are saying that if that happened, any change would need to be coordinated globally. Now, what do you think the chances are of having a unified global approach to vaccinate nearly 8 billion of us with an Omicron-specific vaccine in a timely fashion internationally everywhere? Well, I think you can see that the chances of that in Ukraine aren't very high. And we know that the report we got from Uganda, only 11% of the population have been vaccinated. Now, the chances of having a global response for this are nil. Nil. This is not going to happen. So there's a need for an updated vaccine. Well, maybe in theory, but in practice, it's simply not going to happen. So I really don't think there is. So they're basically saying that these extra boosters, the European Medicines Agency are basically saying these extra boosters aren't going to be tenable, which I agree. Now, this is the CDC data, and it's so disappointing they haven't updated this. Now, how many states is there in America? There's 50 states, I think, isn't it? So we've got data from 2 states from back in January. Where the heck, CDC, where the heck is the updated data on this? Come on. Come on. You're getting a lot of money from American taxpayers. Provide us, well, the American taxpayer primarily, but provide me as well with the data. Why isn't this being done? So this is the data we had from back. So this is hospitalizations in California. But of course, it's out of date data now, but it's all we've got. So here we have people that have been vaccinated, and they have a much lower level of risk. So sorry, the people vaccinated. So as we go up here, we have higher risk. This is higher risk. This is lower risk. So unvaccinated people, obviously very high risk. And it rises and falls with the pandemic. Very high risk because they're naive to the virus. But then when we look at the level of risk for people that are vaccinated without previous infection, that's this blue line here. This blue line here. But the dotted blue line is people that have not been vaccinated but have had natural infection, so they have less risk. Now let's be quite clear about what this data is saying. This data is saying that people that have had the natural infection without vaccination have lower levels of risk than people that have been doubly vaccinated. The natural immunity on these graphics, with or without vaccination, is better than vaccine-generated immunity. And as we go along time, again, we see that there is this waning, but we see that people with natural immunity are consistently doing better. Now, the black line here is people that have had natural immunity and vaccination, and we see that those lines basically superimpose. So this means that for people that have had natural immunity, there is no advantage to vaccination. And given that the vast majority of us now have had natural immunity, I see no advantage to me getting a further vaccine. Unfortunately, I can't tell you what to do, but I can't see an advantage to me getting another vaccine. Because this data shows that the vaccination immunity, these people are still at a higher risk from people that have had the natural infection. So natural immunity winning out there in the California data, And in the New York data in terms of hospitalisation, so here we have increased risk, here we have decreased risk. So people with no vaccines at all and no immunity at very high risk. But notice the way the vaccines are waning as their risk increases here. People that are doubly vaccinated, because the vaccines are waning. So these people have had 2 vaccines and their risk is now increasing. Because remember, the higher, the greater the risk, the lower, the less risk. Whereas down here, we have people that have had the natural infection and their immunity, their risk levels are staying much lower in terms of hospitalisation, as are the people that are vaccinated and have natural immunity, the hybrid immunity. But even the people without the vaccine immunity here, the single dotted line here, they're doing much better than the people that were doubly vaccinated, especially as the vaccines wane. So to me, that is overwhelming evidence that we need to be going down the natural immunity route, not the vaccine booster route. The vaccines were brilliant. They saved a lot of lives in their time. But now we're into endemicity. We need to move away from that. So CDC, please, up-to-date data from the other 48 states and updated data from New York and California on this. And let's not hide this. Let's not pretend that vaccines are better than natural immunity, because these graphics clearly show that natural immunity is better than vaccination. We need to move away from this one-size-fits-all for vaccination and start treating us as individuals. But even if we were treating us on a community basis, the vast majority of people now have had natural infection. And we know this from antibody studies, because when we look for the antibodies, here's the virus here, we see, of course, the vaccines would only give us spike protein immunity, at least the Western vaccines. Whereas now we're seeing people with nucleoplasmid antibody, membrane protein antibody, envelope protein antibody, indicating that they have had natural infection. And if they've had natural infection from this data, I see no place for further vaccination. Let's hope governments come to realise this, and let's hope governments come to realise that the more quickly people are exposed to the natural virus, the more quickly natural immunity in the whole population will be generated. Thank you for watching.